Hi, I'm Adil Fattar and welcome to this series of videos. These videos are part of your consent process, which includes the consultation with me, the written information I gave you in the clinic, and the letters in the post. These videos are generic and an aide-de-memoire, so feel free to watch them as many times as you like, jot down any questions you have, and I'll go through them with you in the clinic at our next appointment. If you're not one of my patients, these videos do not constitute independent medical advice and shouldn't really be used outside of the context of a consultation with me. Either way, I hope you find these videos interesting and informative. Surgical excision of gynecomastia, or subcutaneous mastectomy, is performed usually in younger men who have a distinct hard lump of breast tissue. In smaller cases, it can be performed under local anaesthetic. In larger cases, it may require a general anaesthetic. Either way, it's a day case procedure allowing you to go home the same day. The incision is placed in the lower half of the nipple at the border between the skin and the areola, the pigmented part of the nipple. Through this incision, the nipple can be lifted like a lid, and fat and breast tissue can be removed precisely under magnification. This procedure is best for those with a small button of gynecomastia behind the nipple, the type that makes the nipple look puffy. The sutures are dissolving. The dressing is a layer of glue over the surface. This means you can wash and bathe without worry the next few days. You'll be asked to wear a garment. You may have a tight corset-like garment for the first week, and this will be exchanged for a tight cycling shirt for another 3 or 4 weeks after the procedure. This is partly for comfort and partly to prevent fluid accumulating in the space where the breast tissue was. After the surgery, you will have a scar. That scar may be red and lumpy to begin with and will usually take 12 to 24 months to fully mature. The scar could form a keloid scar, a big thick lump of scar tissue. Thankfully, this is rare, but it's a very difficult problem to treat and may require referral to another specialist for help. After the surgery, the nipple will feel numb, and this is quite normal. It may take several months for this to come back, but the majority of sensation usually comes back within a few weeks. Procedure, there will definitely be asymmetry between the two sides. No one can make their nipples look exactly the same. Any differences should be within normal limits. Things that can go wrong after surgery include infection. The risk of this is in the region of 5%. If you had an infection, it would be hot, swollen, red, tender, and would usually resolve with oral antibiotic tablets. It would be very rare for it to be anything more than that. You may get bleeding after the surgery, manifest as bruising, swelling, tenderness. If there is significant bleeding, you may require return to the operating room to evacuate the bleeding, wash everything out, stop the bleeding, and put everything back together again. It's unlikely to make a drastic difference to your final outcome, but your recovery will definitely be slower with more swelling and bruising. Sometimes, in spite of using a garment, fluid can accumulate behind the nipple. In this case, we can use a syringe in the clinic to remove the fluid. It's usually still numb and so is a painless procedure. It may need to be done more than once. Following the surgery, the nipple can retract or get stuck to the underlying pec muscle. This, when it becomes tethered, can be a very difficult problem to treat and will require further surgery. However, a temporary retraction of the nipple is not uncommon as scar tissue tightens, pulling the nipple in, and then relaxes as the scar matures. Very rare complications would include nipple blistering or loss of tissue or skin. This would leave permanent visible scarring and may require corrective surgery or even nipple reconstruction. If you have a general anaesthetic, there's a risk of clots on the legs. These manifest as calf tenderness or could cause breathing difficulties a couple of weeks down the line. These complications are very rare. More commonly, people have aesthetic complaints, such as they feel the procedure has overcorrected the issue, undercorrected them, or they may simply be unhappy with a technically good result because it simply didn't match their expectations. I'll spend much time with you beforehand trying to meet your expectations and explore your aims and motivations for surgery. Given that we take lots of photos of ourselves in this day and age, you may find that there are certain angles or appearances that you don't like, and this is quite normal. Surgery cannot give you the perfect chest at every angle all the time. Have a look at the other videos for the other procedures for gynecomastia as well. If you're interested in seeing the procedure, have a look at the video I've made for trainee surgeons on ibreastbook.com. Have a look under the gynecomastia section.